Zyloprim is used to treat gout and certain types of kidney stones. It is also used to prevent increased uric acid levels in patients receiving cancer chemotherapy. These patients can have increased uric acid levels due to release of uric acid from the dying cancer cells. Zyloprim works by reducing the amount of uric acid made by the body. Increased uric acid levels can cause gout and kidney problems. How to use? Take this medication by mouth, usually once daily or as directed by a doctor. Take this medication after a meal to reduce stomach upset. If your dose is more than 300 mg a day, you will need to take several smaller doses during the day to get this amount. Ask your doctor for directions. For oral dosage form, tablets, for gout, adults at first 100 to 300 mg per day, taken once a day or in divided doses. Your doctor may adjust your dose as needed. However, the dose is usually not more than 800 mg per day. Children use and dose must be determined by a doctor. For high uric acid levels caused by cancer medicines, adults and children 11 years of age and older 600 to 800 mg per day, taken in divided doses for 2 to 3 days. Children 6 to 10 years of age 300 mg per day, taken once a day for 2 to 3 days. Children younger than 6 years of age 150 mg per day, taken once a day for 2 to 3 days. For kidney stones, adults 200 to 300 mg per day, taken once a day or in divided doses. Your doctor may adjust your dose as needed. However, the dose is usually not more than 800 mg per day. Children use and dose must be determined by a doctor. Contraindications. Should not be given to patients who are hypersensitive to allopurinol or who have previously developed a severe reaction to this drug or to any components. Zyloprim is contraindicated in nursing mothers and in children. Special instructions. Zyloprim takes a while to work. It can take several weeks before the drug reaches its optimal level. Also, your healthcare provider might not start you on the full dose you will eventually need, but will instead increase your dose gradually. People with certain medical conditions should be cautious when taking Zyloprim. Anyone who has ever had an allergic reaction to Zyloprim should avoid taking it. It is not recommended that you take Zyloprim if you have high uric acid levels, as found on a blood test, but no symptoms. Side effects. Typically, starting Zyloprim doesn't cause any side effects. Although not common, one of the most frequent side effects is an increase in painful gout attacks for a limited time. However, this seems to happen in less than 1% of people. It is also less likely to happen if you start with a low prescribed dose and gradually increase the amount you take. Taking colchicine or another anti-inflammatory drug at the same time for at least a few months may also prevent this side effect. Other side effects may include drowsiness, upset stomach, diarrhea.